All right. Well, good morning, everyone. Welcome to the, believe it or not, March Cup of Joe. How quickly things are turning into spring and time changes. So appreciate everyone signing on for this series. And so today we have Justin Beatty and Stephanie Anderson with Mental Health America of Indiana. And for those of you who might not know, Mental Health America has been an affiliate member of the council since we expanded membership. And we not only do a lot of work with them in the policy space, but we also do a lot of work in how can we help bolster mental health and substance use disorder services within the state of Indiana. And one of the great things that has been done with Mental Health America under Justin and Stephanie's leadership is the peer training. And so often, though, when I said that to members, people said, oh, it's too expensive. We can't do it. It's too timely. Well, Justin has some ideas to share with us around apprenticeship programs and ways that maybe we could think about how it could be more affordable and efficient to getting peers trained. So I'm really excited because with the work we've done with peers, especially within crisis and CCBHC, this is such a needed support. And so thank you, Stephanie and Justin, for your support. So just a couple housekeeping items before we get started. If you have not been on a Cup of Joe, it is much easier for Justin and Stephanie to talk to all of your beautiful faces than it is a dark hole. So my preference is camera on if you can. Also putting your name and agency in your box so that they know who they're speaking with would also be helpful. If you can have yourself muted, please have yourself muted throughout, but we will have time for questions for them at the end. And then just, we have done Cup of Joe now for a while, so I think everyone understands its purpose and its vision, but it's really to do things like this, to learn about statewide leadership, to learn about statewide resources, and to connect our network with people who support our network, such as Mental Health America. So just wanted to share that with all of you. So just real quick, before we jump in to Justin, there is a lot. I know you guys find this shocking, but there's a lot going on at the council. And so if you can take note of these dates, today we are meeting with Senator Banks' office, public policy co-chairs, and myself and Sydney around the Excellence to Mental Health Care Act, which is the otherwise known as CCBHC 3.0. I have sent that advocacy out. If you have not yet advocated with your federal representatives, please take the time to do that today. We need this as the next step to help in moving Indiana forward and moving stuff forward nationally. And then March 19th, so next week, quickly coming up, our Connect Hub is back, and we are really excited to be doing a series in leadership. And the first one will be generational leadership. And then on March 30th, it's the meeting with the FSSA secretary. If you have not submitted your questionnaires regarding CCBHC sustainability, whether you are a demo site or a non-demo site, could you please get those to me today? Michael at Blue and Company and myself are meeting, and we are trying to finalize the report to be able to send to the secretary by the 20th. So that would be really helpful. NatCon, I know several of you have registered for National Council's conference, April 27th through the 29th. We will be having a networking event for all Indiana providers in Colorado. So keep your eyes open for that. And then May 6th through the 8th, I wanted to get on your calendar. That is our spring conference and our member awards. If you have not yet nominated a member for one of our member awards, we are going to do it as a luncheon this year. And we have speakers lined up to come talk with us about Medicaid and all the changes that are taking place around updates within the court office with AOT and competency restoration. So it is definitely a conference you will not want to miss. And that will be in Muncie, May 6th through the 8th. And then registration last week went out for Federal Hill Day. I know several of you have joined us at Federal Hill Day, but that is going to be where we are going to advocate for the CCBHC bill, as well as some things around peers and workforce. So with that, I am going to turn it over to Justin and Stephanie to share what they have with all of you today. Thank you so much, guys, for being here.
So I am actually going to start it out, and I will be incredibly brief because Justin has way more important things to talk about than I do. But I think the purpose of what I'm about to say is to help provide some background and some data around why MHAI and you all should believe that peers are such an important part of the continuum of care here in Indiana. So this data summary that I'm presenting comes from MHA National's annual report, which looks at national mental health rankings. So it's the State of Mental Health in America report, and it comes out every year. In 2022, when we were looking at Senate Enrolled Act 1, trying to get that passed, I testified in both committees that Indiana was ranked 42nd in the US in terms of its overall mental health ranking. And that includes so many different data points that get you to your overall ranking. Regardless of those data points, 42nd is abysmal, and it's not, the group that we want to be in. Indiana wants to be a leader, and I think we have and had at the time some really great movement to become a leader in mental health access to care and workforce development in Indiana. This year's report came out, and we were very excited to see that we had moved from 42nd to 14th nationally in just 3 years of reporting, which is a huge amount of movement in terms of improvement in access to care, improvement in substance use disorder prevalence ratings, in improvements in mental health prevalence ratings. So part of what drove that is Indiana had the largest decrease in adult substance use disorder prevalence. So we were the second largest drop in overdose deaths nationwide year over year, and our overall prevalence dropped more than any other state. To look at the data a little bit, and these numbers are itty bitty teeny tiny, but I am sure that Denise will send this out to you all, and you're welcome to then zoom in as well. You can see in this very first chart that Indiana's national ranking in 2021 was 33rd. Then by 22, we went to 42nd, and now we have steadily dropped and had that significant drop in 25 to 14th. Our youth substance use disorder prevalence ranking is part of what is driving that drop. So we were pretty low in 21 and 22, and the belief is that the access to data at that time was skewed because most of the data that drives that information was acquired in schools. And I'm not sure if you remember what was happening in 2020 to 2021, which is where the 21 and 22 data reports come from. School attendance was in person, not in person. And their priority was not necessarily putting out surveys to get data. So we think that 2023 is a really accurate picture of what our overall ranking was, where our prevalence was for youth. And you can see that went from 25th in 2023 to 13th in 2025. Again, looking at the adult prevalence rating, you can see it kind of goes up and down and up and down. 2024, we were 33rd and had this huge drop in 2025 to second. And we can really attribute that drop almost entirely to the increased access to naloxone because our overdose death rate decreased so significantly. Stigma reduction efforts for substance use disorder were really massive under the leadership of Doug Hunsinger at that time. And we just saw some significant improvements in overall the prevalence of substance use in our adult populations. And there are some other factors that led to that ranking drop from 24th to 14th. But one area that I really want to highlight that actually did not impact our ranking and really leads to our discussion about peers is our National Behavioral Health Workforce Availability Ranking. So I will say, just going back to Senate Enrolled Act 1 for a second, the passage of that created some policy reforms that expanded our peer network significantly, created increased access to telehealth, that 988 and crisis services support and financial support for that, as well as the CCBHC development, was huge in that ranking drop. But our behavioral health workforce is really an interesting part to look at. So for this national ranking, our behavioral health workforce looks at bachelor's level staff and above. So this is not looking at folks who are certified in the peer space, but just looking at bachelor's, master's, and above access to workforce. And while we see our overall ratio has improved, so in 2021, our ratio of the availability of behavioral health workforce was 620 Hoosiers to every one behavioral health workforce individual. And it slowly, steadily dropped to 2025 to 500 to 1. I mean, that's a big improvement. Our overall ranking stayed the same. Well, what that tells us is that while we made a dent in increasing our access to those formalized professions, those with a formalized education and a degree, so did every other state. Every other state was focused on that. And so they probably at the same time made those same excellent movement in their overall ratio, which led our ranking to not move at all. So how did our access to behavioral health workforce ranking not move, but our overall ranking in behavioral health across the United States improve? Well, it's 100%, in our opinion at MHAI, related to peer workforce. We did so much work around improving access to peer workforce and growing and developing that peer workforce throughout the state. And that is not captured in that ratio. And so we really think that this demonstrates the importance of peer workforce. And I think that provides us a great introduction to what Justin's about to talk about and how we have developed and would like to continue to develop and give access to increased peer workforce. I will be happy to take questions at the end or if you want to put them in the chat, but I do want to move on to Justin in the interest of time.
Thanks, Stephanie, and thanks, Zoe and team, for inviting us here. As Stephanie stated, one of the things we're really focused on is building the peer workforce, and we've heard overwhelmingly the thing related to cost. So one of the things we've done is tried to move as much of our efforts away from the mental health and substance use space around workforce development and align it with the Department of Labor, who actually whole purpose is to build the workforce. And so as part of this, the Department of Labor has what's called a RAP, a registered apprenticeship program. If you pay attention to what's been going on at the federal level, you've heard the current administration talking about apprenticeships ad nauseum, the funding they're going to put into it, and everything. This is a huge focus of the next 3 years or more. And so as part of that, we were somewhat intuitive and in a partnership with HRSA in 2023 created a registered apprenticeship program that from 2023 to the end of 2025, we built out through private scholarship funding to work out all the kinks. And so we're super excited to now roll this out available to the public. I'm going to share my screen and walk through some slides just so people understand what a registered apprenticeship is, because we know overall in the behavioral health space, this is a newer concept. And so therefore, we don't want to assume anybody knows any of the details that are important around this. So as we look at this, what is this apprenticeship program? The first thing to recognize is a structured earn while you learn program providing paid work experience with training and certification. During the 12 months of the apprenticeship program, the person will get 2,000 total experience hours. Included in that total experience hours is their onboarding process, the shadowing of services. They shadow what's called a journey worker. A journey worker is essentially an experienced mentor who does the role. There's supervised service delivery, where the journey worker, that experienced mentor they're paired with, shadows them as they deliver services, and then independent service delivery. And what this does, it builds a work-ready certified peer recovery coach program and professional through education and hands-on learning and mentorship. One of the things we've seen from both employers and the certified workforce is there's this assumption that because someone's went through base training to become certified, they're ready to just rip and run and do all the work by themselves. And I'm going to be very honest with you, that's terrifying, because there's a lot they're working with. And so we hope that you'll see these experience hours mimic how your onboarding process, them learning from a person there to learn specifics to how, whether it's Centerstone, adult and child, whoever it may be, they're learning from them how to specifically do your role. Because in the training, we teach the fundamental skills to provide peer recovery support. We don't know the specifics to your organization of how to do it. And so that's where that on-the-job training after their initial training and certification teaches them the specifics of the roles within your organization. Some things to focus on related to this. This is a year-long DOL apprenticeship program, so that means it is approved by the federal Department of Labor and de facto then approved by Indiana Department of Workforce Development. Indiana Department of Workforce Development has a pre-apprenticeship program that we're also approved for, but the focus is to make sure everybody's enrolled in that federal apprenticeship program that opens you up to a lot more funding opportunities. During the initial part of this apprenticeship, they will earn the Certified Peer Recovery Coach Associate certification that's required prior to the onboarding. The reason we do this is so from the day one of the person hitting the floor in your organization, they have a reimbursable certification. This certification is recognized by Indiana DMHA and the Indiana DWD as a promoted industry certification. This certification is billable through Indiana Medicaid, Recovery Works, and Indiana Problem Gambler Awareness Program. So there is multiple funding sources from day one, from reimbursement of that person hitting as soon as they're providing services. If you're interested in becoming an apprenticeship site, I'm going to drop a couple links in the chat when we're done here. There's an interest form you can fill out. This is just a high-level overview. Our goal is to sit down with each one of your organizations and really look at what does this mean for your organization to be a registered apprenticeship site with ICATA through the Department of Labor, and what all the aspects of that look like. A key piece of this is the pre-apprenticeship process, because that offers education and pre-vocational training to meet apprenticeship entry requirements. So this is some of the stuff we do ahead of time. This is targeted outreach to underrepresented, underemployed, or unemployed populations. And what this does is, as I mentioned, it's just a precursor to get them ready for that DOL thing. The difference between a pre-apprenticeship and a full apprenticeship, the pre-apprenticeship is recommended to be a paid position, however, can be a volunteer position. The DOL position, the apprenticeship must be a paid position with stated pay increases as metrics are hit. Part of this apprenticeship program, you do receive free technical assistance from ICATA to help strengthen your program. We have a very detailed competency matrix and supervision packages and things like that with documentation so you can measure their growth that your organization is free to use afterwards. And some of the site requirements is willing to become an on-the-job learning registered technical instruction site for our approved apprenticeship program. You currently have a paid position or willing to host or create a new paid position for this apprenticeship, and you're willing to employ an ICATA trained and certified peer recovery supervisor as a journeyman. One of the things we will do for apprenticeship sites, we will pay for your person to attend peer supervisor training if they have not through the MHAI Training Institute and assist with the cost for them to become certified. That's one of the value added benefits of being a registered apprenticeship site. And another one of the big ones is that we have all these here, but here's the cost factor is our certifications by being recognized by Department of Workforce Development means they're eligible for WIOA and other funding dollars reimbursement. So what does that mean for your organization? As long as there's eligible funding in your region, 100% of training is paid for. 100% of certification is paid for. $0 out of your organization's pocket to get the person trained and certified. And then there's additional training and education that's required for the apprenticeship that DWD 100% pays for. So all the training, all the certification related fees for the registered apprenticeship are completely paid for as part of this. Then another part of it is this employer ready grant. So when you're working with us as a DOL apprenticeship site, you can apply as your organization for up to $5,000 per employee trained and retained for 6 months, up to 12 apprentices total. So that, or not 12, 10, they lowered it. Sorry, it used to be 60,000, now it's 50. So that's $5,000 you can put towards that person's salary by hosting an apprenticeship. And so when we think about this, we've heard you overwhelmingly about cost being a barrier to training, employing, and retaining peers. Our program offers 100% of the training and certification fees paid and the opportunity for you to apply through DWD for that employer ready grant that's $5,000 per salary up to 10 people. We're ready to go throughout all this. I'm going to drop in the chat the links for the employer ready grant, the apprenticeship interest form, and then also we're partnering with the Great Lakes ATTC to do a national webinar more on this if you're interested in learning more here in the next couple weeks. It's on March 19th. So I'll open it up for any questions for me or Stephanie that you may have. And also, Zoe or team, will you be able to provide them the slides after this and that one-page handout?
Yeah, we send out the recording with all attachments, and we put it in our all members section of our website.
Okay, so yeah, you'll get the slides, and then we also have a one-page fact sheet. You'll get Stephanie's data report. You'll get a fact sheet around this apprenticeship so you can capture all the information as well. But if you have any questions for either Stephanie or I, please feel free to raise your hand or just come off mute and ask them, as long as we're not talking over each other.
Any questions? I definitely think it's a great resource. And I think when Justin shared with me about going through it through the Department of Labor and working our Department of Workforce and working through the apprenticeship because of seeing federal dollars and whatnot is a very wise move to help us in bolstering peers. So I appreciate Stephanie and Justin working with them to help in getting this apprenticeship program going. Any questions about how to get it started? Do you guys see this as a resource for your staff and see this as something that could help in bolstering your peer workforce? Okay, well then, hearing none, we will send the links out to everyone. But like Justin said, the next steps is really scheduling a call with him to individually structure what this would look like for all of you. So please reach out, and his contact information would be there. So that would be the next step as far as getting this apprentice program going in your individual community mental health centers or CCBHCs. Justin or Stephanie, any final words before I wrap things up?
Thank you so much for having us today. I really appreciate it. And I hope I did put the national report link in the chat if you're interested in diving even more into the data and all of the different areas that drive that ranking. You may be able to use it for a grant application somewhere as well.
Yes, I use that resource in policy advocacy quite often. So thank you. Thank you for that. It is a great resource. So please check that out if you want to pull that from the chat. So just a couple wrap up items. A reminder, we are still doing the Behavioral Health and Aging Certificate Program for all staff within our membership. So if you are interested in this program, please reach out to Amanda Deaton. We are also continuing to look for new members, such as Mental Health America of Indiana. So anyone who supports community mental health, certified community behavioral health clinics, who offers and bolsters not only from a policy and a voice standpoint, but as we saw today, from a resource standpoint, please reach out to Leanne. For those of you who have might not heard, we are in a very heightened primary election. There are folks that we work with who are having people run against them. We, as a result, looking ahead and being strategic, are continuing to raise money for our PAC. So if you have not yet had a chance to donate to our PAC, please take the time to do so. And then last but not least, we will put the survey links in here. Leanne is leading two initiatives for us right now. One is our member survey, and the other is our member awards. So if you could take the time to complete the member survey for us, this is used in our strategic planning that we do with the board every June. And so your voices are very important in the strategic direction of the council. And we would like to celebrate all of you in May. So please take the time to nominate. It doesn't have to be within your agency. It could be within outside an agency, but please take the time to nominate. So without further ado, I am going to look at my Starbucks winner here and see randomly who we have. So Tracy Blickfeld, you will get our Starbucks gift card today. So let's raise our cups and cheers to all of you. Please reach out to Justin and Stephanie about this wonderful program. And if there is anything that the council can do to support all of you, please don't hesitate to let us know. Have a wonderful start to spring. Take care, everyone.